Okay, so I'm going to approve that grossing. This all looks benign. It's much easier when it's benign. The real time-consuming step is circling tumor. Kind of busy, but not worth it. Just looking to see if there's any like acute inflammation. Sometimes I like to at least give them a reason why the patient might have elevated PSA. I think that's probably benign, but it does makes me a little bit nervous. Maybe I should order a pin 4 on that one. So order a pin 4, go back here. I could, if I thought this was all benign, which I think it is, click that. 74, almost certainly Medicare. So bill that. Now I'm gonna wait until the slide comes back tomorrow before chances are that's benign, but I wanna make sure. So this one does have ancillary tests, so I can, depending on the results of this pin 4 tomorrow, I'll either approve the confirm and deny the decipher, or approve the decipher and deny the confirm. Report preview, and then done, signed out. If it was benign, if I was convinced it was benign, I would sign that out right now. And what did that take me, like 2 minutes?